Hey, welcome to The Explainer. Today, we're going to break down a really powerful framework that's all about helping you, the patient, completely change the conversation about chronic pain with your doctors.
I mean, does this sound familiar? Your whole complex day in, day out experience with chronic pain? Does it get boiled down to just one number in the doctor's office? If it does, you are so not alone. It's a huge frustration for so many people. But here's the thing, it really doesn't have to be this way.
And really, at the heart of all this is that feeling of not being believed, right? I mean, this quote really hits on it. People with pain are often met with skepticism, even doubt. It can feel so invalidating. But if you're armed with the right tools, you can really start to build a true partnership with your provider.
Okay, so first things first, let's just make sure we're all on the same page. When we talk about chronic pain, we're not necessarily talking about a specific cause, like arthritis or something. The real key here, the defining factor, is duration. We're talking about pain that's stuck around for the long haul.
So how do we get there? Here's the roadmap for our explainer today. We're going to cover crafting your story, setting new goals, building a team, and finally, putting it all together for a whole new conversation.
All right, Section 1, crafting your pain story. The absolute first step to changing the whole dynamic of your appointment is just preparation. It's all about walking in the door with a clear, well-thought-out story of what you are actually experiencing.
And this is how you do it. Organizing your story around these 6 key points it's a game changer. Think about it. When did it start? Where does it hurt? How long has this been going on? What does it feel like? Is it sharp, dull, burning? And crucially, what makes it better or worse? And what have you already tried? See? This takes it from just, I'm in pain, to something structured, something actionable that your doctor can really work with. It paints a full picture, way beyond just a number.
And hey, here's another great tool. A picture is worth 1,000 words, right? A simple pain diagram like this can be so effective. Before you even go to your appointment, you can map out exactly where it hurts. You can even use different colors or little symbols for different sensations, like sharp versus aching. It just communicates so much information. Boom, all at once.
Okay, so you've got your story ready. Now for the next crucial step, shifting the focus of the conversation. We're moving beyond just the pain itself and onto functional goals. We're not just talking about reducing a number anymore. We're talking about improving your actual life.
And this slide says it all, really. It's a huge shift. Instead of saying, I want my pain to be a 4 out of 10, what if you said, I want to be able to walk my dog around the block? Or I want to go to my family's get-togethers? Or even just, I want to be able to pot some flowers on my patio? See the difference? You're redefining what success means. It's not about an abstract number. It's about real, meaningful, concrete things. This changes everything.
And the great thing is you don't have to pull this new way of talking out of thin air. There are actual validated tools out there that are designed to help you have exactly this kind of conversation with your doctor. And the PEG scale is a perfect example. It still uses that familiar 0 to 10 scale for pain, but then it adds 2 more critical questions. E for enjoyment of life, how has pain interfered with that? And G for general activity, how has pain interfered with that? It's brilliant because it takes the number and ties it directly to what actually matters, your quality of life.
And once you're talking about goals, the SMART framework is perfect. It helps you and your doctor work together to set targets that are specific, measurable, agreed upon, realistic, and time-based. So it's not just, I want to feel better. It's, okay, within a month, I want to be able to walk for 30 minutes 2 times a week. It makes your progress real, something you can actually see.
All right, next up, building your team. This is so important. One of the biggest realizations in managing chronic pain is that you don't have to do it alone. In fact, you probably shouldn't. The best treatment is almost always a team sport.
And the research on this is really clear. A holistic approach, one that combines a bunch of different types of treatment, just gets better results. We're talking about things like physical therapy, patient education, psychological support, all working together to tackle the pain from every possible angle.
Okay, but there's a really important, kind of subtle difference here. You're not just asking for a multidisciplinary team, which is basically a list of different specialists who all do their own thing. What you really want is an interdisciplinary team. And that's a team where all your providers are actually talking to each other, they're communicating, and they're all focused on the same shared goal, your goal.
And that team can include all sorts of experts. A pain specialist, a physical therapist, maybe an occupational therapist, a psychologist, a pharmacist. I mean, the list goes on. Each one of them brings a totally different and vital piece of the puzzle, because they understand that chronic pain isn't just a physical thing. It's biological, psychological, and social. They're all there to help you manage the total impact of pain on your life.
Okay, so let's put this all together. We're going to boil it down into a simple, memorable action plan that you can literally take with you to your next doctor's appointment. It really is this simple. 3 steps. 1, tell your story. Walk in prepared. 2, state your goals. Focus on function, not just a number. And 3, ask for a team, a real interdisciplinary team. This 3-step approach, it's totally transformative. It changes your role from just a passive patient to an active, empowered partner in your own care.
And ultimately, that's what this is all about. This quote sums it up perfectly. The focus shouldn't be on the pain score. It should be on your functioning, your emotional, physical, and social life. The goal is to lessen the impact that pain has on your world and give you back that sense of control.
And one last thing on that, it's also important to be realistic. Research actually shows that even a 30% improvement in pain and function is considered a huge clinical success. It's not about being pain-free overnight. It's about making small, steady, meaningful gains.
So, what's the big takeaway here? It's a message of hope, really, and it's backed up by some really practical tools. You have the power to change the conversation, to shift from just managing a disease to actually building a life. Remember, you are the expert on you. This is all about empowering you to lead the way.
So let's leave you with this question. What if your goal wasn't just less pain, but more life? That's the new conversation. It's a total shift in perspective, and it's one we really hope this explainer helps you start.